line. Thank you so much for allowing me to go.
Thank you, Senator Hassan. Senator Scott.
Thank you, Mr. Chairman, and to the panel. Thank you all for being here virtually. Without any question, we find ourselves in a situation that we wish we were not. And I'm very thankful for folks like Dr. Birx, Dr. Fauci, and many others for your dedication 24/7. Without any question, our nation is safer because of your hard work. I want to direct my questions towards Dr. Fauci, really one specific question, Dr. Fauci, and I'm thinking about the reopening of America and specifically the reopening of South Carolina. And I'm taking into consideration the fact that in South Carolina, I think overall our cases are moving in the right direction. We have a little less than 8,000 cases, unfortunately 350 deaths. Our hospital capacity is actually better now than it was when the pandemic started. Our ability to isolate hotspots and mitigate the spread of the virus is, I think, where it needs to be. With that in mind, I flew into Washington from South Carolina yesterday. We have plans to test additionally 220,000 more residents by the end of this month, focusing on at-risk populations. By the end of this month, we will have tested 100% of nursing home residents and the staff that takes care of them. And after increasing our contact tracing workforce 20-fold in the matter of weeks, our state's health department announced yesterday that we're going to increase it by an additional 1,400 contact tracers. We have built and we continue to build the tools necessary to better detect and isolate cases, to map their exposure, and to prevent substantial spikes moving forward. Most importantly, our healthcare system, thanks in part to flexibilities from this administration, has the beds and the equipment necessary to address the most serious cases when they arise. Now, with these tools in hand, we have begun to reopen. To be clear, we continue to scale up testing and to take measure to protect the most vulnerable. And the data points are increasingly clear. For older Americans and for those with chronic conditions like diabetes and high blood pressure, this virus remains a threat, a dangerous threat. A recent report suggested that in New York, roughly 90% of the fatalities had underlying issues. 2/3 of fatalities were 70 years or older, 95% over the age of 50. In South Carolina, the median age of patients who have died from the virus, 76 and a half. Nearly 2/3 of fatalities have been patients older than 71, and nearly 90% were over the age of 60, and roughly 98% in South Carolina are over the age of 50. Contrast that with those aged 20 and younger, where we've seen no deaths. Fewer than 1% of deaths in my state have been under the age of 40. Every single death is a tragedy. Every single one. And we mourn with our family members who've lost their loved ones. We are taking every measure to protect our older South Carolinians as well as those with underlying conditions. But when we set out to flatten the curve by taking aggressive, unprecedented measures like staying at home orders and mass small business closures, we didn't set out with the goal of preventing 100% fatalities. That would be unrealistic. It is impossible. And we didn't set out to keep quarantines in place until we found a safe and effective vaccine. That would take too long. Dr. Redfield, your agency put out a helpful graphic showing two curves. One, which spiked quickly and peaked high, reflected daily cases without protective measures. The other, flatter curve, showed cases with those measures in place. And the whole point, which the graphic illustrated, was to make sure that we did not exceed hospital capacity. So, while I respect the need for caution, we are too often presented with a false dichotomy, either saving our economy or saving lives. We've seen the goalpost around flattening the curve move, and I think that's unfortunate, because at the same time we're doing that, businesses have collapsed, mental and physical health have declined. Depths of despair escalate, educational outcomes nosedive as we wait in our living rooms praying for some good news around therapies and around vaccines. We set out to flatten the curve, and I think we've done a pretty good job of that. We need to do better, and we will do better. My question, Dr. Fauci, is as we start the process of moving towards reopening South Carolina, what else would you suggest that we could do to protect our most vulnerable populations?
Thank you, Senator Scott. You gave a really very eloquent description of what I think would be a model way, the way you've approached this. I mean, you have put things in place that I think would optimize your capability of reopening. And as I was thinking as you were speaking, I'd almost want to clone that and make sure other people hear about that and see what you've been doing. The issue of your direct question to me about the vulnerable populations is that, as we have said in our guidelines, and it looks like you are ready to progress carefully because you put into place a very good system, that the vulnerables, the elderly and those with underlying conditions, should be those who at the very last lifting of mitigations should be those who are left in a situation where they might be in danger of getting infected. In other words, protect them right up until the very end of the relaxation of your mitigation. Because as you said very correctly, those are the individuals that are the most vulnerable to the morbidity and the mortality. So those are individuals, particularly I might say, sir, those in the minority group, the African American and Hispanics, who for a variety of situations that are the social determinants of health, have a greater likelihood of not only getting infected, but of also having the underlying conditions that would make their risk for a high degree of morbidity and mortality higher. So it looks like you're doing things very, very well, and I would encourage you to continue and to follow the guidelines as you get closer to normalizing your state. Thank you.
Thank you, Dr. Fauci, and I'll just simply close with this since I'm out of time. Thank you for the many conversations that you and I have had about those vulnerable populations, to include minorities as well as our senior citizens. I will say that without any question, when you look at nursing homes, it's typically African Americans and Hispanics are the certified nursing assistants who are providing care for the elderly population. So your focus on those two very vulnerable groups is much appreciated, and thank you for your expertise.
Thank you, Senator Scott. And Senator Smith.
Thank you so much, Chair Alexander and Ranking Member Murray, and thanks to all of you for being here today and for your service. Dr. Fauci, I have to say you are in the unenviable position of being the person that so many Americans and Minnesotans trust to give us the straight scoop and tell us what's really happening. You're about the facts and not about the politics, and that's a really good thing. So I have to start by asking a question that I think a lot of Americans want to know, which is, how are you doing? How are you holding up? It's been an unbelievable effort.
I'm doing fine, Senator. Thank you very much for asking. This is such an important problem. It transcends all of us individually and has to be working as a team. And I enjoy very much working with your senators and the governors, because it's at the local level that we're going to make this thing work. So I'm fine. I appreciate your concern.
Well, a lot of people are thinking about you and are grateful for your service, as we are for all of you. So we're gathered today to think about what we need to do to reopen our economy. And I think first about what's happening in my home state of Minnesota, where agriculture is such an important part of how our state works. It's a part of our history and our culture. Pork processors right now are looking at the reality of euthanizing thousands of hogs a day because there is no place to process them because of what's happening in the processing plants. And the working people who do the hard work in those processing plants are getting sick. So here's one story. This is one worker, the Star Tribune wrote about this, named Homare de Jesus. She's an asylum seeker and a mom who works for a contractor that does the cleaning in the processing plants. And she works for $14 an hour, 7 hours a day, 5 days a week. And her job is to sanitize the machines that process the meat into ground meat. And she started feeling sick on April 11th, but she kept going to work. And on April 21st, when one of her coworkers fainted, she told her supervisor that she felt sick, and so she was told to go home, but that if she didn't show any signs of illness, she should come back. She went to the doctor and she paid $115 to get a test and found out a few days later that she was COVID positive. And she's still at home. She's not getting paid, and she doesn't have health insurance. And nearly 2 weeks ago, President Trump deployed the Defense Production Act to keep these processing plants open. But the USDA gave really limited guidance about what would be safe for those workers. It said, for example, in response to testing, which has been such a big part of what we've been talking about today, they said, this is a quote, "Facilities should consider the appropriate role of testing in workplace contact tracing of COVID-19 positive workers in a worksite and assessment." So Dr. Fauci, as we think about how we move forward, we all want to open up the economy. What guidance would you give us in a situation like this here in Minnesota?
Well, I can give you my common sense guidance, although this is not the area of my expertise. It's more in others, but it would seem that if you want to keep things like packing plants open, that you've really got to provide the optimum degree of protection for the workers involved, the ability to allow them to go to work safely, and if and when individuals get infected, to immediately be able to get them out and give them the proper care. So I would think when you're calling upon people to perform essential services, you really have almost a moral responsibility to make sure they're well taken care of and well protected. And again, that's not an official proclamation. That's just me speaking as a physician and as a human being.
Well, thank you, Dr. Fauci. And I think that you speak as a human being, but you also speak as the chief epidemiologist of our country and the person that we all trust. And this is the point that I want to make and drive home with everybody, which is this is the kind of guidance that we should be getting and following. And then these are the tools that we have got to have in our country if we are going to reopen our economy as we all want to do. And if we move forward with reopening our economy, and yet we still have circumstances like we had in these processing plants and in other places around the state, we are going to be right back where we started, and except even in a worse place, as I think you pointed out, Dr. Fauci.
But thank you, Senator. And again, it really does relate to one of the questions that one of your colleague senators asked me before, that one of the things that I keep emphasizing, and I'll just repeat it again because it's important, that when you are in the process of opening up and pulling back on mitigation, you really must have in place the capability of responding when you do have the inevitable upticks in cases. That will absolutely occur. It's how we deal with it and how successful we are in putting the clamps on it that will prevent us from getting the kind of rebound that not only from the standpoint of illness and death would be something that's unacceptable, but it will set us back in our progress towards reopening the country.
Thank you very much, Senator Smith. Senator Romney.
This hearing and the participants in it. Admiral Giroir, I'm going to take off where Senator Hassan spoke. I understand that politicians are going to frame data in a way that's most positive politically. Of course, I don't expect that from admirals. But yesterday you celebrated that we had done more tests and more tests per capita even than South Korea. But you ignored the fact that they accomplished theirs at the beginning of the outbreak, while we treaded water during February and March. And as a result, by March 6th, the U.S. had completed just 2,000 tests, whereas South Korea had conducted more than 140,000 tests. So partially as a result of that, they have 256 deaths and we have almost 80,000 deaths. I find our testing record nothing to celebrate whatsoever. The fact is their test numbers are going down now because they don't have the kind of outbreak we have. Ours are going up as they have to. I think that's an important lesson for us as we think about the future. On a separate topic, my impression is that with regards to vaccines, where I'm critical of what we've done on testing on vaccines, we've done a pretty darn good job of moving ahead pretty aggressively. And yet the president said the other day that President Obama is responsible for our lack of a vaccine. Dr. Fauci, is President Obama or by extension President Trump, did they do something that that made the likelihood of creating a vaccine less likely? Are either President Trump or President Obama responsible for the fact that we don't have a vaccine now, or in delaying it in some way?
No, Senator, not at all. Certainly, President Obama nor President Trump are responsible for our not having a vaccine. We moved, as you said, because I described it in my opening statement, rather rapidly. No one has ever gone from knowing what the virus was to a phase 1 trial as fast as we've done. So I don't think that's something that one should say anybody's responsible for doing anything wrong on that. I think that's right. That's the correct way to do it.
Thank you. That was my impression. I was surprised by the comment, but that was my impression. Dr. Redfield, Senator Sinema and I wrote a letter to you expressing our dismay at the lack of real-time data at the CDC. I'm talking about granular, demographic, hospitalization, treatment data. How is it possible in this day and age that the CDC has never established such a real-time system with accurate data? And what can Congress do to rectify that so we never have to look at something like this again? There you go.
There I go. I'm sorry. Senator, thanks for the question. I think you've hit one of the how important they are. The first one I focus on is data modernization, data analytics, and predictive data analysis. Clearly, Congress has moved forward in providing funding for data modernization, and we're in the process of implementing it. The reality is there is an archaic system, a non-integrated public health system. Each public health department has their own systems. This nation needs a modern, highly capable data analytics system that can do predictive analysis. I think it's one of the many shortcomings that have been identified as we went through this outbreak, and I couldn't agree with you more. It's time to get that corrected.
Thank you. Please help guide us as to what we need to do to make sure that happens. And I presume it's not build it ourselves, but work with companies that have that capacity and use that capacity in our favor. Dr. Fauci, one last thing which relates to a virus, and I know I'm asking you the impossible question, but we're all hoping for a vaccine, obviously. It's the objective of our administration to get it as soon as they can, and from what I can tell, they're pulling out all the stops to do exactly that. Given our history with vaccine creation for other coronaviruses, how likely is it? I mean, is it extremely likely we're going to get a vaccine within a year or two? Is it just more likely than not, or is it kind of a long shot?
It's definitely not a long shot, Senator Romney. I would think that it is more likely than not that we will, because this is a virus that induces an immune response that people recover. The overwhelming majority of people recover from this virus. Although there is good morbidity and mortality at a level in certain populations, the very fact that the body is capable of spontaneously clearing the virus tells me that, at least from a conceptual standpoint, we can stimulate the body with a vaccine that would induce a similar response. So although there's no guarantee, I think it's clearly much more likely than not that somewhere within that time frame, we will get a vaccine for this virus.
Thank you. Mr. Chairman, I yield.
Thank you, Senator Romney. I want to thank the witnesses for their patience. We have 4 more senators, and we'd like to give them a chance to ask their questions. So, Senator Jones.
Thank you very, very much, Mr. Chairman, and thanks to all our witnesses for your being here virtually and also for your incredible service during this time. I want to follow up real quick with an additional statistic that Senator Romney talked about with regard to South Korea, and that is the fact that we are a nation that has about 6 times the population of South Korea, but yet we have about 310 times the number of deaths from this pandemic. So I think we have to be very careful in making comparisons around the world, comparing the United States to other countries. Dr. Redfield, I want to follow up just a little bit with what Senator Murkowski and I think Senator Kaine talked a little bit about contact tracing and where we're going. I understand that you are working with states to try to develop plans for reopening. The testing is important, the contact tracing is important, but using that data as well is also going to be important in terms of the quarantine plans that Senator Murphy talked about, child care facilities to allow people to put their kids in a facility while they are still go back to work. All of those issues, including maybe even facilities like vacant hotels or motels that may be used for self-isolation. How is this plan being developed within the CDC? Are those plans going to be individualized by state? Will we, as a member of Congress, have access to those plans? And how are states going to pay for these? And I say that because my state's already using the money that we've already given them as a wish list. I mean, they're talking about building a $200 million state house as opposed to developing the test and doing the contact tracing. So I'd like for you just to drill down a little bit on how these plans are going to develop, what access we will have to have those plans and be able to see them.
Thank you very much, Senator. This is obviously, as I said before, this is a critical component of us taking this time that we have now to get prepared for next fall and winter and building that comprehensive contact tracing capacity. We're working individually with the leadership of the state health departments, the local health departments, territorial and tribal, to try to let them get us to understand what they think their capacity needs are. And those discussions have already happened. As Admiral Giroir said, there's been a variety of federal agencies together on testing and contact tracing. CDC's in position that we've reprogrammed our individuals that we have across the country, over 500, begin to help each of these states. We've augmented that with some additional personnel that we're bringing on board state by state through our foundation. We've moved about $106 billion of the money that Congress has appropriated into the states so they can begin to start thinking about how do they want to hire for a longer-term contact tracing capability. And then, of course, it was mentioned that we're other government programs like AmeriCorps, Peace Corps, so that each group is going to construct their contact tracing piece to what they think their needs are. And I do think it is going to be similar to what we heard from the senator from South Carolina. These are significant increases. He said he increased 20-fold, and they're going to increase again. But the point you brought up is also critically important, and we found that as we already struggled through the repatriation of different Americans from around the country, where we had to put many of these in quarantine, as you know, ended up using military bases, because many of the state and local health departments really haven't developed that system. Where do they put somebody who to be in isolation who's homeless? How do you develop those systems? So this has to be part of it too. Is it there's certain capacity that's intrinsic, or is it certain hotels, as you mentioned? I think the point that was made by one of the other senators is so important about individuals that, particularly like, say, the meatpacking individual that has to go home and self-isolate, but maybe they don't have ability to go home and self-isolate because they live in a multi-generation house with about 12 other people. There has to be mechanisms to be brought in to actually have an effective way to identify cases, identify contacts, and then do the appropriate public health measure. And it does have to be comprehensive. It's going to be developed one jurisdiction at a time. I see no reason why these are not transparent documents as they get completed. And it really is a tribute to what the congressional support that you have given so far. As I said, $1.6 billion got into the state and then begin to do this in addition to the resources that we've gotten. But it is fundamental. People underestimate how important it is that we have a highly functional, comprehensive, aggressive contact tracing program so that in the next phase of this outbreak, we containment. We don't have to switch for mitigation.
Right. Thank you, Dr. Redfield. I appreciate it. It sounds to me like we've still got a lot of work to do. So thank you.
Thank you very much, Senator Jones. Senator Braun.
Thank you, Chairman. Been so much